At 52 years old, Dave Doucette is rocky on his feet.
I just seen my cancer doctor last week, and like she said to me, she said, "You're not looking awful good for someone who should be dead."
Doucette's medical problems began last July when he found a lump under his armpit. He went to the ER in Halifax 4 times. They ordered a biopsy and told him to wait for the results. With each day, he was worse. He lost his balance and could barely stand.
My whole left side was just blown right, 15 times its normal size, my whole left side.
When the hospital didn't admit him after the 4th visit, Doucette's girlfriend became irate. Nova Scotia's health authority can't talk about specifics, but says the emergency department typically asks specialists to do follow-up tests.
That's when we went up the road, and I called the ambulance, and they came and got him. Because he really didn't have the energy to fight back. You need to fight for them. And you need to stand your ground, and you got to make yourself known.
Doucette has stage 4 non-Hodgkin's lymphoma. According to his hematologist, after they called 911, there were doubts he would survive the night. Doucette spent 4 months in hospital and lost nearly 90 pounds.
To me, being from here, unacceptable. And I'm sure there's every Nova Scotian would say the same thing.
Part of the problem is that Doucette hasn't had a checkup in years, one of the 100,000 Nova Scotians without a family doctor. Without old blood tests, his specialist has no idea when the cancer developed.
What is wrong with the government of Nova Scotia that we can't get some doctors in here?
In Nova Scotia's House of Assembly, Doucette's story sparked outrage.
Again, I too read the article, Mr. Speaker, and the experience that Mr. Doucette had is unacceptable, Mr. Speaker, at any time.
On Monday, the government announced it will raise doctors' pay in an effort to lure family physicians to the province. Doucette found out this week that his cancer is now in remission. His palliative care team helped him find a family doctor. He's making the most of his recovery, using it as a chance to put a face to a challenge confronting communities not just here in Nova Scotia, but across the country. Carolyn Ray, CBC News, Halifax.
And Carolyn's been doing some digging, looking at how other communities have tackled the problem. And beyond simply paying doctors more, there are certainly other ways to go too. In Nanaimo, BC, for example, it's estimated 10% of the population doesn't have a family doctor. So the province upped its recruitment game. It's laid out all the steps a foreign doctor needs to practice in BC, and there are dedicated people manning phone lines to walk prospects through it.
It just made it that much easier to come here.
BC recruiters also try to address each doctor's needs, whatever it takes to seal the deal. And the tiny town of Goderich, Ontario takes that thinking to the next level. Its recruiter personally reached out to prospects, and the town of about 7,600 people even built a new clinic and recreation center to attract them.
Doctors are not going to come to rural Ontario not unless they're able to have the same amenities as they would in the city.
In the early 2000s, the community had just 5 doctors. Now it has 18.